Hey, good evening, everyone. I feel like I haven't seen everyone in a long time, and I'm glad to be back. I missed last week's session of Back to Basics because it was my birthday and we were celebrating. But I'm so glad to be back, and we have an awesome guest, Nick Hofmann, with us this evening. And I'm going to let Nick talk about himself a little bit. But before I do so, for those who don't know me, I'm Dr. Vivian Asamoah. I'm a functional gastroenterologist in Katy, Texas. And you guys are live with us tonight on Back to Basics. This is our 11th episode. And we have been talking about kind of celebrating or bringing an awareness to asthma. May is Asthma and Allergy Month. So we've been talking a lot about food allergies, food sensitivities, seasonal allergies. And today I really want to talk about the treatment, or sort of like natural treatments for these different entities. So I have a special guest on, and I'm very excited because this guy knows a lot. He knows a lot of information. So Nick, thanks for joining us. Tell us a little bit about yourself, and we can jump right in.
Yes, I appreciate you having me on. It's an honor to be here, and I appreciate the introduction. For those who don't know me, my name is Nick Hofmann. I work for a company called Orthomolecular. So I work with providers all across the greater Texas area who take more of a integrative or holistic approach to treating patients. And they want to take an integrative and holistic approach to specific conditions and disease states, and food allergies, seasonal allergies are definitely something you could take that natural approach to. And that's how I spend most of my days, is meeting with providers and having these conversations.
Awesome. This is going to be an excellent session because I think there's a lot for us to learn. And guys, trust me, Nick knows his stuff. We're going to have to pull him back sometimes. Hey guys, nice to see you guys on. I know I started a little bit early, so if you guys have friends in the community who don't know that we're doing live at 6 instead of 6:30, please call them in. But Nick, let's just go straight into the biggest issue that bothers a lot of people. And it really is seasonal allergies, right? It's the environmental toxins, is the environmental and the seasonal allergies, the pollen that gets to us from the different type of plants. And, we were talking to Dr. Doan Nguyen a couple of weeks ago, and, we spoke about immunotherapy, right? We spoke about that being a good solution. We also spoke about stuff you can get over the counter, like antihistamines and like Benadryl and Zyrtec and all these other things. We kind of spoke about some studies that are coming out showing some long-term possible risk of using these medications long-term, one of them being Alzheimer's dementia. Mm-hmm. Did you know that? Because I didn't know that.
Yeah, actually, there was a somewhat well-known study that was put out by Indiana University School of Medicine a few years back that was talking about these OTC allergy medications and cold medications that have this anticholinergic type impact. Mm-hmm. And actually, the researcher in the study, when he was asked, would you recommend these things to your parents or grandparents, he said, not a chance, because especially in the elderly, it was shown to decrease brain volume, and actually the terms they used in the study were brain shrinkage, and they talked about decreased brain volume. So I did hear about that, and that's while there are a lot of these things out there and they might be good for the short term, a lot of people take them long term, and it might not be the best option for everybody long term, especially people as they get older.
I mean, I think people as they get older, but I'm also thinking kids, I'm thinking of my son who has a lot of seasonal allergies, and basically he takes a pill a day, every single day. And he's going to get used to taking that in his teens, in his, 30s and 40s. And before you know it, he's been taking some kind of antihistamine, anticholinergic for like 50 years.
Right? I would agree with you. This study, or the studies they've done so far, just happen to be on an older population. Right. There haven't been as many studies done on kids yet, because they're probably not seeing these sort of negative cognitive issues yet, but it might only be a matter of time. I'm sure you would agree. I would suspect that it probably is having some of the same impacts on the younger ages as well.
Absolutely. So let's talk about what we can do from a more natural, integrative standpoint, right? What can we actually do when we know we have seasonal allergies and the season is about to begin, right? The season of allergies. So for some people, it's year round in Houston.
Yeah.
What kind of natural herbs or supplements do you advise?
Yeah, there's a variety of things that can be done as far as you're talking fundamental basics and things that are
Mm-hmm.
more specific for seasonal allergies. And I always, when I have this conversation, I like to talk about helping people understand what the allergic response is, right? And when
Mm-hmm.
we breathe in these allergens, they get grabbed. And I know we were talking about an IgE antibody. They grab these things and they dock onto a mast cell. And when this mast cell pops, it releases histamines, and that's why people take antihistamines, and it releases other these inflammatory mediators that's the reason this cell popping is the reason people get all the symptoms of allergic response, no matter if it's the watery eyes or itchy eyes, the sneezing, the scratchy throat. That's the allergic response. And a lot of the approaches to dealing with this, these antihistamines, they're not stopping that root cause, which is that cell popping. They're dealing with a symptom of the allergic response. And while antihistamines traditionally,
once the histamine has already released from this mast cell, right?
Exactly. And while that might be helpful in the short term, it's doing nothing to stop the root cause. And I know from our conversations in the past, and the conversations with a lot of my providers, we want to get to why are you having this allergic response? What's causing it and how can we stop it? And this is for seasonal allergies or even food allergies. If you can stop that histamine response or stop that mast cell from destabilizing, we often talk about, you can stop this response at the start. And that's a lot of the things we talk about. And I know we talk about, and this might be a little bit too much information, but me and you have had conversations about your Th2 and Th1 responses, which is your Th2 is more of an allergic response and Th1 is more of immunological. And for those 40 plus million people dealing with allergies, that they have more of a Th2 response. And if you could shift that response to more of a Th1, a more immunological, things like immunotherapy do that, then you can significantly reduce the allergic burden that you're dealing with, especially with seasonal allergies. And so when we're talking natural approaches, I want to do things or recommend things that are going to help shift that immune response to a more less allergic and more immunological.
So Nick, let me use so many pearls in what you're saying right now. So many pearls. Let's go back to Th1, Th2. We're now guys, natural gut relief group. We want to learn so we can understand why we're using the supplements that we use or the herbal treatments that we use. But when you say Th1, Th2, you're talking about the way the lymphocytes, which are the white cells, right?
Yes.
Carry out an immune response, like what pathway they go through, right? And in Th1 type and Th2 type, there are two different sort of mechanisms or pathways, right? And so now you're looking at a strategy to shift one from one to the other, right? So that the immune response is better tolerated by the body, basically.
Correct. Yes. It's basically how these white blood cells or how this response is impacting these B cells to basically put you at risk for allergies or not. And it could be a variety of things. It could be how we were raised. It could be where we were raised. It could be what we ate as kids. It can be if we were on several cycles of antibiotics. Those things can either predispose us to being more allergic to something or less allergic. And I mean, I always talk about the hygiene hypothesis. They talk about the kids when they were young, if they were, rolled around in the dirt and exposed themselves to a lot of these allergens and antigens younger, then their body became used to it. And so when they got older, they didn't have these severe allergies. And that's what it is. If you can shift to being less Th2 and more Th1, you can significantly improve your seasonal allergy type issues.
So the root cause of that immune response, kind of a little bit like autoimmune disease too, the root cause of allergies, right, really depends on a lot of other factors, right? It's you're predisposed to developing allergies because of other root cause issues that we're dealing with. So when we start talking about natural herbs and supplements, we want them to really address the root cause and not just the symptoms like the sneezing and the itchy throat and things like that, correct?
Absolutely. And it was a cascade of lifestyle decisions that probably put each of us in the situation we're in. And for allergy sufferers, it was probably a lot of decisions made early on in life that maybe by their parents, maybe by themselves, that probably put them at a more higher risk to have seasonal or perennial allergies.
So what are some of the things that can help us shift that immune response in terms of natural things to do?
Yeah, there's a few things, and the number one thing I recommend that not a lot of people know about is probiotics. I know we're both big advocates of probiotics, but some of the recent studies over the past few years have shown some of these probiotic strains having the ability to shift that immune response from less of an allergic to more of an immunological. And if you can have a healthy microbiome, and we know just having this conversation of 70% of your immune system being in the gut, and it had that healthy microbiome, and these probiotics being able to shift that immune response, it can put you on the right path to having less symptoms of seasonal allergies. So
this is all going back to the gut and the health of your gut microbiome, the health of that ecosystem, right? So this about, so probiotics, this is so interesting. Can you tell us what kind of strains of probiotics should we be looking for?
Yeah, most of the studies, they're looking at a blend of different strains, because the importance of probiotic strains is having at least a couple different strains that work in different parts of the GI tract, because that way it has a more broader impact than just using one strain that works in one part. But most of the studies were done on some lactobacillus strains, and then a few bifidobacterium strains. But one of them specifically was Lactobacillus rhamnosus and Lactobacillus paracasi and casi. And these are just a few of the strains. But just like we were talking earlier, I would suspect that this is something they're seeing only because they've tested these strains. As they test more strains for this, it's basically, I don't know if it's a specific strain benefit, but it's healing the gut type benefit.
I see. So it's all going back to the gut, guys. Again, everything going back to the gut. All right. So probiotics is one and that you should take sort of regularly, right? If you have, seasonal allergies or atopia or food allergies, of course, right? And food sensitivities. What else? What other type of natural herbs and supplements would you recommend?
Another one, a foundational type product like a probiotic, is there's actually a good amount of studies and research on fish oil and anti-inflammatory diets, and looking at, especially kids, they've looked at a lot of studies with taking 500 milligrams of EPA DHA daily in kids for up to 6 months. Those kids showed significantly reduced symptoms, allergic symptoms, especially allergic cough. And it makes sense. Me and you both know how the anti-inflammatory benefits that fish oil can have, and that's just another foundational thing.
Absolutely. Nick, I think when most people think of fish oil, they think of, that smelly, it makes me burp, fishy and everything. And most people think it's actually just for managing cholesterol or managing hypertriglyceridemia. But omega fish oils, EPA and DHA have such strong anti-inflammatory effects. They actually help stabilize the lining of a lot of membranes in the gut, in the brain, and definitely modulate, right, inflammation and how you respond to them. So that's one that I give my son every day. Yeah.
Yes, and that's a good one. And I often tell providers, it would be easier for me to say the things fish oil doesn't do than what it does, or what it does, because it does so many different things. In regards to, heart health and immune and anti-inflammatory, mood, all these different things.
Wait. I have a question.
Yes.
Okay, when we go out looking for fish oil, right? Yes. You are an account executive with Orthomolecular. So you guys make a bunch of different fish oils. And so what kind of quality should we be looking out for? What is it in the concentration of EPA versus DHA and the quality? Some people are taking krill oil. Some people are taking, other brands. What do you suggest?
Yeah, well, when you're looking at some of these other krill oil and algae oil and these other things out there, the most abundant research there's significantly more research on fish-derived omega-3s, your EPA, DHA from fish. So I always personally, based off the data, recommend fish oil from your small fish that are low in heavy metals. And when you're picking the right fish oil, there's a few things you want to look at. And one thing you can always see on the bottle, or hopefully it's on there, is a triglyceride fish oil. And what a triglyceride fish oil is basically that's the form of the fish oil you get if you had fish for dinner tonight. You get that EPA, DHA in the triglyceride form. A lot of the stuff that's cheaply made is using a different form that's called an ethyl ester form that is just our body doesn't recognize it. It's poorly absorbed. And it's sometimes one of the biggest things that's really hard to tell when you're looking for a fish oil is the big concern is if the fish oil becomes oxidized, it becomes smelly, it makes you burp, it doesn't do any good for you. And there's a concern amongst some of the people in the industry that a lot of this fish oil, when it's gathered and first this molecularly distilled, it sits in an oil drum for some of these large retailers for years. It sits there for years, and if it's sitting in a drum or sitting on a shelf for a long period of time, that's not good. You want to make sure you get a quality fish oil that hopefully was, just harvested a few months ago.
So when you look at your supplement bottle for the fish oil, will it say triglyceride derived? It
should say triglyceride. So it'll either say triglyceride or ethyl ester.
Okay.
And ethyl ester is honestly, it's a cheaper version to make, and that's why a lot of people can make a huge jug of fish oil for $5 because it's a much cheaper process, but your body doesn't recognize it and absorbs it very poorly. When you're looking at a bottle, there's a few things I say, because especially with fish oil, a lot of it is really good marketing and not so great products. And the few things I say, look for the triglyceride form, and then when you're looking at it, look at the EPA DHA on the back. That's really the only thing that matters, is how much, or one of the most important things is EPA DHA. I want to get everybody, healthy person should be taking at least 1 gram of EPA DHA a day. That's what the American Heart Association says. And there's a lot of tricky marketing. If you look at a bottle, it says 1,000 omega-3s, and then you look on the back and it only has 100 EPA and 100 DHA.
Right, exactly. So that breaks it down. Yes, that's really important.
And so make sure it's potent and make sure it's the right form. And then if you do that, you're on the right track.
Okay. All right, guys, community guys, natural Facebook group, Gut Relief, go ahead and ask questions. We are here Nick is here to answer all your questions. As you can tell, he is extremely knowledgeable. I mean, I'm already learning a ton in these 5-10 minutes we've started. So we talked about probiotics. We talked about the strains. We've now talked about good quality EPA, DHA, omega fish oil supplements. What else can we use?
Those were just foundational things. Those are what people should be taking every day. Now, if you're an allergy sufferer, whether it's seasonal or perennial, there's some things out there that are specifically good for that response. And we talked earlier about if we could stop that cell from popping, then we can stop the root cause of allergies. And there's some raw materials that have good data on being mast cell stabilizers. They stop that cell from popping. And one of these raw materials that is very well known is something called quercetin.
Quercetin, yes.
Yes, and quercetin at certain potencies has been shown to be a very therapeutic and not only help with anti-inflammatory benefits of the allergic response, but it stabilizes that mast cell. So that cell, like I said before, it doesn't pop. It doesn't release the histamine and everything that causes you to have those symptoms. So that's that root cause approach.
Where is quercetin from? Where is it derived from?
So quercetin's a flavonoid, which a flavonoid is somewhat of a generic term that describes over 4,000 compounds that come from a variety of different plants. So it's a botanical derived type raw material.
Okay. What kind of dose are we looking for in quercetin?
I mean, it depends on how severe the allergies are, but usually because quercetin might not have as good as an absorption rate as some of these other natural approaches, we typically recommend taking 400 milligrams a couple times a day for a week. And then after that, just taking 400 milligrams a day should be good. I know that probably sounded a little confusing, but you take more up front, allow it to stabilize all those cells. And then once it's builded up in your blood, then it does a pretty good job of staying there. So we do something, or we recommend something called like a loading dose of doing anywhere between getting close to 1,200 milligrams a day. And then for the first week, and then after that, just 400 a day. And it works. It usually works wonders for people.
So this loading dose is the dose that you would need sort of like when you're entering that allergy season, right?
Correct.
Just to kind of shift that immune response, right, to that Th1, Th2, just to kind of reduce things. So you would start and load it, and you would load for, with you guys' protocol, how much?
7 to 10 days.
10 days, okay. And then you would take it every single day just to reduce the risk, right?
Yeah, so this, I mean, when you're taking these natural approaches, this is something you'd want to do on a daily basis. You wake up and take your natural raw material, in this case being quercetin, like I said, and we just discussed, hey, do your loading dose just to build it up. Yeah. More is better up front. Get up to 1,200 milligrams, and then after that, just 400 a day is a great option to maintain. And if you know next week we're gonna have a lot of pollen in the air, load up now. It'll help you in the long run. I promise you that.
So Nick, we're going to go back to a question. Someone has jumped in and asked that their box of their fish oil says 1,200 EPA and 900 DHA, molecularly distilled Icelandic wild-caught fish. Is this good?
Yes, I mean, that dose is ideal. I like that dose a lot. I said 1,000 milligrams is the bare minimum. This is twice that, and there's a lot of studies that show that dose is perfect. So I'm happy with that.
Okay. So with quercetin, and I know you guys with Orthomolecular, you actually have a really, really good product that I love, that I just started on my son because I'm trying to get him off antihistamines. But what kind of response should we expect? Like, what are you guys seeing? What's the feedback from patients?
Yeah, when you take some of these natural things like quercetin and the other things it's often combined with, is people will start noticing a symptomatic improvement within a couple of days. But the goal with a lot of these things is the longer you take it, the better it works. The more it builds up in your blood, the better it's going to work. And unfortunately, if you're in the midst of an allergic response and you have bad allergies and those cells have already popped, no matter how good it is, it's not going to glue them back together. What it's going to do is going to provide some symptomatic relief, and then it's going to stop the future cells from popping. And unfortunately, there isn't, as far as I know, in the natural world, things that are putting those cells back together quite yet.
Well, I do use quercetin quite a bit, and of course, I mean, I focus really on the gut, so I don't see a ton of patients with well, I do see a lot of patients with seasonal allergies because there's always that cross reactivity, right? So I do use it a lot in our patients who have histamine intolerance, right? Yep. So they're high histamine foods, liberating histamine foods they don't tolerate, and we use quercetin, and it works like a charm. It works really, really well in suppressing some of those symptoms. Are there any side effects with quercetin or any medications like prescription or other supplements or natural herbs that it may react with that we should be careful with, or is it fairly safe? What would you say?
It's very safe. And quercetin is very safe and very well tolerated. The studies that have looked at it, I mean, some patients have had minor GI upset on quercetin, but that was a very small percentage of the patient population. But these things are very well tolerated, and I should have mentioned it before. Quercetin was actually so effective in what it does that there's been several pharmaceutical companies that have developed products with a similar mechanism.
Oh, I see. Excellent. Okay. What else? What else we got?
I think quercetin's one that a lot of people do. Nettles, if you've heard of stinging nettles, that's something that's often been studied for the allergic response, helping calm the inflammatory cascade, I guess, that happens when people breathe in an allergen. So stinging nettles is another natural botanical type approach. There's something that has actually been talked about a lot frequently. So maybe you've heard of N-acetylcysteine.
Yes.
Which NAC, often referred to as NAC, has helps with respiratory function, but especially for allergies, there's a few studies that propose the mechanism of it breaks down disulfide bonds in mucus. So it breaks up when you're really congested and you can't breathe. N-acetylcysteine will help clear that out. That's
Mucinex.
Yes.
That's Mucinex pretty much, right?
Yes. Similar. Very similar.
Yeah. So these products exist, I mean, over the counter as well. You just kind of have to know what to look for. Guys, be careful. There are many different forms of Mucinex, right? There's some Mucinex that even contains like pseudoephedrine that will dry you out. So you don't want to do that. You want to go more for the natural product itself, and use that on a regular basis. So that's a good one. Yeah.
Yeah, and then those are some of the main things. And even doing some of we going back to the foundational, I mean, there's taking adequate amount of vitamin C, vitamin D. Some of these immunomodulators have been shown to be helpful. And there was one small study that showed patients who were deficient in vitamin C tended to be that group that got more cases of upper respiratory tract infections and then higher allergic symptoms in this small study. So that's just, again, your foundational type things.
I mean, I think that, we can't talk about seasonal allergies and shifting the immune system without mentioning vitamin C. So, and vitamin D, actually, right? So those are really, really important. And I think they've gained a lot of recognition since COVID, right? That we know that it really does help modulate the immune system. So that's really, really important. I'm going to ask you a quick question. I have one question. I have one of our members asking, can you have mast cell issues if no sinus or allergy symptoms, but they're dealing with SIBO and H. pylori leaky gut and they're not able to eat a lot of foods? Is it just from the SIBO or is it a mast cell activation issue?
And I think you touched on this a little bit before, how you use it in your practice, but yeah, you could absolutely have mast cell or histamine response type issues and have no allergic symptoms. And it could be happening in a whole different set of symptoms that could be showing themselves in maybe a histamine response turned into a body rash or in some cases acne or GI upset or food sensitivities. This histamine response, you might not even know it's happening because you're not having any of the cough or sneezing. It could just be happening behind the scenes, like the patients you're seeing.
Yes, absolutely. Absolutely. That's, I agree 100%. NAT, quercetin have both been suggested to prevent COVID infection. Is it the same mechanism? It is really, it's that shift, right?
Yeah, it's a shift in the immune response. I know, it's kind of an interesting subject on some of the things that are going around talking about COVID, but quercetin has been thrown around a lot out there. And quercetin and acetylcysteine, a lot of these natural things, they do a lot of different things. And there's been some good data on N-acetylcysteine for boosting respiratory function and acting as an antioxidant. And quercetin is well known at translocating zinc into the cells to help zinc act as an immunomodulator. And quercetin also inhibits specific proteases associated with certain viruses. So if it can inhibit those proteases, it can help act as somewhat of an antiviral. And then it also helps in the immune cascade. At the very beginning of all the craziness, people were worried about this immune cascade or this inflammatory cascade more likely. And basically, if you could stop that, it's going to help out. And whether it's doesn't matter any type of viral challenge, quercetin will help with that in those mechanisms. And same with
I see quercetin in a lot of different scenarios, right? It's kind of this. It's actually a really, really important, I think, a supplement, natural supplement. We use it a lot in autoimmune disease, skin lesions, seasonal allergies, just like we've discussed, SIBO, where there's a histamine intolerance. So it definitely has multiple roles in adapting that whole inflammatory cascade. So that's really, really important.
And I think that's the beauty of a lot of natural approaches is it works on so many different levels and it works with your body, as opposed to maybe some of these other options out there that take more of a conventional approach where they're targeting an enzyme and shutting it off, or they're inhibiting a specific cascade by working against your body. And I think the beauty of these natural approaches is all that it can do.
Yeah, that's absolutely true. And that's why we really on Natural Gut Relief really focus on natural approaches to heal the gut. So we're going to end with that one more question, right? Because we started off talking about how if a gut microbiome, if the ecosystem in the gut microbiome was off, it could result in increasing atopy and, developing these food allergies or seasonal allergies, right? Now, when you are trying to heal your gut and restore your gut, what are some of the natural products that we can use? So I can imagine someone who is allergic to peanut, right? If they have an episode, or someone who has an intolerance or sensitivity, if they continue to eat their foods, and now they're actually trying to eliminate and heal their gut. Nick, what products, what herbs and supplements would you suggest?
Yeah, there's a variety of things. I mean, I think you emphasize it a lot in talking how diet and avoidance is often great, but we live in a world that's not always conducive to gut health, and it's always important to rebuild not only the gut lining and making sure those cells that are dealt with on a daily basis are strong and working properly, but also that mucus layer, that first line of defense is working, yes, that gut barrier. And I think you see it on a daily basis, how maybe a patient might have an allergy test and might be sensitive to a bunch of foods, and then you heal their gut a few months later and they're not sensitive to those foods anymore. And we see that, and there's a lot of things that can do it. We talked about probiotics, right? Probiotics, they inhibit pathogens, they help you absorb your nutrients, they take away some of those bad guys to allow your gut to heal itself. There's some raw materials out there, glutamine. Glutamine's a big one. Glutamine is essentially the fuel source that allow your gut cells to regenerate. If you give enough glutamine, those gut cells will regenerate. And there's aloe and N-acetyl D-glucosamine. These are some natural things that will rebuild that first line of defense, that mucosal barrier. And that's very important as well. And then I know you're familiar with things like colostrum or serum immunoglobulins, which that is basically, they work by binding harmful pathogens and antigens and allergens, really. And I know we're talking about allergens now, but these things bind them and pull them out before they can get through the gut lining and cause inflammation and your immune system to go haywire. So I guess simply put, a good probiotic, a glutamine, maybe a colostrum or immunoglobulin, these are things that if you stick to a regimen like this for 3 to 6 months, you should see a significant improvement in a lot of areas of health, including your allergic response.
Yeah, I agree with you 100%. And, you started off by saying, a lot of it is truly the diet and making sure that you are eating a wholesome, non-processed diet, filled with that rainbow of fresh fruits and vegetables, if you don't have oral allergy syndrome and you're not sensitive to them, but just to kind of rebuild that gut microbiome and, get the nutrients that you need to make your entire immune system much stronger. Nick, this was really, really helpful. I mean, there's so much to learn from you, and
thank you.
In 30 minutes, we've learned a ton. I hope you get a chance to join us again. I think we will have to have you come back for another session of Back to Basics, but thank you.
I appreciate you having me. It was wonderful chatting.
Yeah, it really was. So you guys have a wonderful evening. I hope you guys learned. Everyone is excited and saying thank you, thank you. I hope you guys got some tools. We're going to try and post some information online. Orthomolecular actually has a really, really good line, I think, of anti-natural, seasonal allergy type products that I use, and I use on my son as well, that has actually been working well. So if you guys want any more information, feel free to message me in the comments. All right, you guys, it was fun connecting again. Next week is going to be an awesome session. Go ahead and keep putting in your comments, put in some likes, share some love. We'll answer all the questions that we can, and y'all have a wonderful evening. Nick, thank you so much.
Thank you. Have a good rest of your evening.
Bye-bye.